Okay, I think we're recording. All right, so I'm Jacie Punky,
And I'm Katlyn Popkin.
and we're doing a response discussion to the article discussion on informed consent. And so when I was watching the video, I was looking at their part about Canterbury and Spence, and they talked about how much information is enough information. And all I could think was that this was a good start line. It wasn't everything that needs to be done yet, but it was a good place to start. I thought that the next few court cases that came later were a little more important, and the details in them made it so we are in the medical scene that we know today, if you know what I'm saying.
Yeah, and I think they did a really good job in the video discussing all the court cases and how that led up to where we are today. And I think
Mm-hmm.
some of them are really important, like telling us your level of education or your level of knowledge,
Mm-hmm.
which with whatever surgery you're performing, or if you have any other reason to be performing the surgery, whether personal or economic benefit.
Mm-hmm.
I think that's really important because it will weigh into a person's decision if they're comfortable getting the surgery or not.
Yeah, what really surprised me is that being like your experience as a physician being disclosed wasn't mandated sooner. Like
Yeah.
that's usually one of the first things I ask a doctor when I go, like, how long have you been practicing medicine? Like, I want to know who I'm dealing with.
Yeah, but I think a lot of people, especially if you're getting knowledge of that you have a life-threatening, something wrong with you that's life-threatening, that you need immediate surgery, maybe
Mm-hmm.
they're not fully thinking all the way through. They don't realize
Yeah.
I should probably check to see if this doctor
Yeah.
has, I know when you go to important doctor's appointments, they tell you to bring someone else just so they
Mm-hmm.
have a steady mind and they're in the right emotional space.
Yeah, emergencies are definitely very different. I feel like a lot of these informed consent rules go out the window when it comes to an emergency, which I completely understand. But in a perfect world, I feel like all of these things should have been implemented way before they actually were. Like,
Yeah. Yeah, and I think today there's still probably some gray area that maybe that will be
mm-hmm.
improved on, but
Yeah, we still obviously have a long way to go, but we're getting there.
yeah. One of the other things that I thought one of the the article brought up was being in the right psychological state, being
Mm-hmm.
a psychology major. That's really important to me. And I know before we were talking about this, you
Mm-hmm.
mentioned maybe having someone there if there is something emotionally or mentally um, wrong with someone, then you should have someone to be able to translate that could talk with them easier,
Mm-hmm.
or so they're not completely left in the dark, because I do think they have a right to know what's going on, even if it
Yeah.
be difficult for them.
Yeah, they obviously don't deserve to be completely left in the dark. It's their body. Only they really know what's happening. They only know how much it hurts or how weird it feels. Like they need to be spoken to in some form by the physician. It's important for that to happen. But maybe if they are not completely mentally well, it's important to have a third person to communicate that through so you can get the best information possible.
Yeah. And then another thing I thought they brought up was important was minors, and that goes
Mm-hmm.
along with people who are maybe not emotionally in the right headspace, whether they should know what's going on or not. I think
Mm-hmm.
that goes for minors as well, that they should definitely be at least in the know and part
Yeah.
of the decision to some extent.
Their voice should be a part of the conversation, at least a little bit. Like I said, they only know what their body is feeling.
Yes, especially in the
So they
story.
only know what would make it feel better.
Yeah. And the story about the little girl who,
Mm-hmm.
I know, she definitely needed to be part of the decision, but also I can see an argument to the other side where she
Mm-hmm.
didn't want the diagnosis, so she wasn't going to tell us all the information or stuff like that. So I could see
Yeah.
where the parents should have control in some sense, but not all of it.
Yeah. As we were doing the homework, we had that little flow chart and it showed like how much we agree or disagree. And I couldn't find myself anywhere but the middle. because I see why a kid should be able to have a say in what's happening, but I also see why they don't. Like, they're still little kids and they don't understand all that medical jargon. They don't understand any of that, but they do know how much it hurts.
Yeah, I definitely could see both sides of the flow chart as well. Like, if you look at it this way, it could be this, but if you look at it the other way, it could be this.
Yeah, it was really hard for me to determine, and I feel like whenever I do questions like that, I'm in the middle.
Yeah.
But what I did find pretty cool about the article, I wouldn't say cool, but the exceptions to informed consent. Like, I feel like a lot of those could be avoided with, like, what's it called? Power of attorney. If everybody had that person that was clear on what they wanted, a lot of these could be avoided.
Yeah, I agree.
Like, if the patient's unconscious and incapable to give consent, that third person would know exactly what this person wanted in that situation when they were clear in the mind.
Yeah, I agree with that too.
I don't know. I just feel like those exceptions might not have to be exceptions if everybody had a power of attorney, which might not be realistic.
Yeah.
But in a perfect world.
Yep.
So I don't think I have any more left to respond to from their video.
I don't think so either. I thought they brought up some really good points.
Yeah.
And really kind of encompassed the whole article.
Well. Oh, I lied. I have one more thing. What I thought was cool, she was able to come up with an example about her knee.
Oh, yeah.
Because getting a surgery would interfere with what she liked to do. So she was able to speak with her doctor before giving consent to the surgery, which the doctor thought she needed, to come up with other ways to heal her knee, and she would still be able to do what she loves to do.
Yeah.
And it's times like that when consent and making sure the doctor's aware of things that you like to do is so very important.
Yeah, I do think there's a lot of gray area about what doctors should tell, and it's kind of hard to decide exactly what the rules are, but I think these cases give us a good place to start with it.
Yeah. I think this is a good baseline. Yeah. We're making advances.
All right, and I think that's all.
I think that's all we got.